Hi, everybody. I'm Amy Caldwell. I'm a local real estate agent with the Marshall Berch Group at Bolst Inc. I am here with Irene Stephanopoulos. She is a family nurse practitioner at Emory at Oak Grove Family Care. And thank you so much for joining
Oh,
us.
you're welcome, Amy. You're welcome.
So I know a lot of people maybe haven't met you, or I always get questions for good medical care in the area, and I've seen you for a couple of years. So I just thought, I would like to share. I always like to share good resources in the area. So tell me, what brought you to the Atlanta area, first of all?
Well, what brought me was my daughter, actually. She relocated to Atlanta and she was down here, oh gosh, almost 5 years. And every year she kept bothering me to come down, and she would visit and say, you need to come down. I have other family here too. So eventually I migrated down, and I do like it.
Do you like the milder winters?
Love the milder winters. I don't miss the heavy snow, the ice, the 2 degrees. Traffic's a little challenging here, but
No kidding.
Yeah. That's the biggest thing I had to get used to was the traffic and the volume of people, because I came from a smaller area.
Oh, yeah. Well, that's Atlanta.
Yeah, that's Atlanta.
So you are a nurse practitioner. For those who don't know the difference between a nurse practitioner and a doctor, can you share a little bit about that?
Sure. So nurse practitioners are nurses first. That's our background. And I know for me personally, I worked in intensive care for many years. I did administrative, and I wanted to do more.
Yeah.
Well, I didn't want to go all the way back and be a physician. That takes, a lot more time. It's a different, not avenue, but different road to get basically to the same place. So you go back to school, you get more education, so that you can then diagnose and treat and prescribe and do diagnostics like x-rays. So it just is a more education to allow you to practice more of as a practitioner.
How much more education did you have to have?
About 3 years more. So a total of 7.5.
So you're like as much as a doctor.
It's a lot. It's a lot, that's for sure.
Yeah.
What's nice though, in between that, when I worked as a registered nurse, I'm still dealing with, assessing patients. And so we know we assess, we know lung sounds, heart sounds, and all that. Then we know now, okay, you have this diagnosis. What do I need to do to treat it? So we extend it that way. But with the nursing background, we tend to look more holistically. What's your home life like? Who do you live with? I tend to ask questions, especially with my elderly patients. Did you drive here today? So it's beyond what's your blood pressure today.
That's great.
Yeah. So I think we take a little more time, and that's the reason why.
I think so too. Yeah, I agree. Well, what would you say is your specialty? Like, what are you passionate about in your work? Or
good question. I say overall, I think it's the preventative piece of it, and that's why I like primary care, is to say, okay, your blood pressure is getting here. Let's look at your diet. Things to prevent us from having those chronic conditions that impact long term. So, let's prevent diabetes. You're getting close. What do we need to do? So I would say my passion is to try to get people to take their health seriously and prevent things.
Instead of expecting just to take a pill to cure everything.
Exactly. Yep.
Yeah. Well, what drew you to medicine in the first place?
Well, I have a story for that if you want to hear it.
Yeah.
I actually was probably around 9 or 10. I had to get my tonsils out. I was scared as anything. And back in the day, your family weren't allowed to stay. And I remember being in the hospital and my mother having to leave, and me just being so upset and crying. And I remember the nurse came in and sat with me and made me feel better. And I remember thinking, gee, I want to do this. I want to comfort people and help them, and I want to be a nurse. So yeah, just caring for people.
Yeah, well, that's a good reason.
Yeah.
Well, so we touched a little bit on this area and why you moved here. What is something that you enjoy about living in this area?
I think there's a lot of activity here. I think I see people out and about doing things and enjoying life, whether it's going to festivals or to concerts or to the book drive. So always something to do. And I'm a doer. I also like that there's lakes around that you can drive to an hour or so away. So you can be a part of a city life here, and then you can go enjoy, hiking, and
Hmm.
there's just a lot of activity. And I keep saying there's a lot of life here because people are out enjoying themselves.
Yeah, I mean, the climate is helpful with that. I think we have a lot of biking trails and hiking around here,
Exactly.
and lakes, yeah, for kayaking and
Yeah,
all that
and
good
that's
stuff.
what I started doing. I started kayaking. We got a little trailer. We've been doing some of that, so it's been really nice, really enjoyable.
Oh, that's good.
COVID sort of threw a wrench in that, but we're getting back on things now.
Well, it pushes you to be outside, doesn't it?
Yeah, it does.
Yeah. So, what is one tip that you would give people for a healthier lifestyle?
Keep moving. I
Hmm.
think it's really important. I think it's a challenge to move sometimes because, hey, it's been a long day working. I want to sit and watch TV.
Hmm.
But there's a little saying, to be around, you have to move around.
Hmm.
And it's really true. I think just keeping as active as we can.
Yeah.
Mhm.
Good. Well, thank you so much for coming in and sharing with us. And hopefully, people will find you because I think you're a great resource.
Thank you. I appreciate it.
Yeah. Once again, I'm Amy Caldwell, local real estate agent with Pulse Inc. And if you have a business or a philanthropy that you would like to share, just reach out to me at parkbench.com/Toco Hills. And thank you so